Unfortunately, in our country, in Malaysia, right, bariatric surgery is not yet recognized as a disease, meaning to say it can be claimed through the private insurance, for example. So, for bariatric surgery in Malaysia, it has to be out of pocket, okay, for a lot of patients. Okay, so typically the cost is going to be around from 16,000 to 42,000, depending on the specific type of procedures that patients are going to go for. So that is the range from 16,000 to 42,000. Okay. There's actually obesity, right? Obesity and morbid obesity is actually recognized as a one form of disease that is claimable under the early EPF early withdrawal, from the account too. So that is an example of how people can secure the funding for the surgery before the to fund for the operation. Okay. So as with everything in the world, everything got its risk, and we always weigh the risk and the benefits. Okay. So when we're talking about the surgery itself, okay, there's a risk of common with any surgical procedures like bleeding, okay, and something that is more specific to the bariatric surgery itself is, for example, the leaking. There's a risk of leaking where the place that we cut the stomach might have some defect, which will lead to the leakage of the gastric content into the abdominal cavity. So that's another one, okay. And then there is risk of infection, which is like related to the surgery itself. And then there's a risk of mortality also related to the surgery. In the 1950s, okay, the mortality was high, but I think recently, due to the advancement in the devices, in the technology, and the more simplistic approach that people use nowadays to do the surgery, right? Okay, when we're talking about mortality associated with the surgery, is about 0.13% these days, in this days and age. And then when we're talking about the risk after the surgery, right, for the long term, we are talking about, for example, for people who are very big before the surgery. Okay, after the surgery, they will have some like loose skins, flabbiness of their skin. During the interim period where they are losing the weight, they might have some hair loss, but usually the hair will comes back. Okay, after about maybe 9 months, 8 months after the surgery, the hair loss will comes back. Okay, another common risk associated with the surgery is people might have a reflux, meaning to say that they have a gastroesophageal reflux, where they might feel some heartburn after the surgery. And then and then another thing that very important also after the surgery, there's actually, it's not a sure thing as well. Okay, there's actually a small risk of failure associated with bariatric surgery. Meaning to say, either they don't lose much to begin with, or they lose and then they gain back most of their weight that they have lost. Okay, it can still happen even with bariatric surgery. Typically, what we see failure in people who refuse to change their lifestyle after the surgery. They have this mindset that surgery will fix everything. They don't have to do anything. They will just lie in their bed doing nothing. Okay, so for this kind of people, the weight is bound to come back because after like many years, okay, they stay back to their old habit. Their eating pattern will they will be able to eat more than before, so they will gain weight. Okay. So for people who are struggling to lose weight, right? If people who have tried on their own, they cannot maintain the weight loss, my advice would be you need to have a tailored approach according to the individuals. Meaning to say, someone who has 20 kilos to lose cannot go for the same thing for example, compared to a person who only has 5 kilos to lose. Okay, if you need to lose 5 kilos, 7 kilos, you go for a specific ways. Maybe go on a formal diet exercise program, sign up for a gym membership, then there should be enough for you to lose weight. If you have 15 kilos or 20 kilos, the approach will be different. Okay, you might consider medications, certain devices that may be able to help you to lose weight. And for people who are morbidly obese, having an excess of weight of about 30 kilos or more, they need, one of the things that might be considered is bariatric surgery. So it's not a one treatment fits all approach. Okay, it needs to be tailored according to the individual. So that we should change our mindset towards weight loss. Instead of just the same thing for everyone, it needs to be according to the person's needs, based on their health status, based on their lifestyle, and based on their job and family situation maybe.
Alright, thank you doctor so much for your time.
Alright, welcome.
All right, thank you so much.
Thank you.
All right, thank you for watching. This has been Health Matters with me, Dishen Kumar, and today we talked about bariatric surgery and also what people who are morbidly obese actually go through. So if you like more information, please follow us on all our social media platforms and also watch this on AstroAwani.com and also on YouTube. My name is Dishen Kumar. I'll see you in the next episode. Goodbye.